Complete information on essential hypertension and vital high blood pressure is noted hypertension. There are two huge classes of primary, essential, of high blood pressure and secondary high blood pressure. Crucial high blood pressure is a medical state in which the blood stress is chronically high. Crucial hypertension is a blood pressure that's uniformly higher than the ordinary whilst no motive for high blood pressure can be located. Important high blood pressure impacts 75 million individuals more or less. One thinks of the genetic elements to play a part ahead within the development of crucial hypertension. The genetic elements which have an effect on the machine of renin-angiotensin-aldosterone. About 30% of case of essential high blood pressure are ascribable to the genetic factors. Essential hypertension in common have a specific anomaly of the arteries, and multiplied resistance, lack of elasticity, inside the tiny arteries that are furthest away from the coronary heart. Blood and the food oxygen boxes offer of small arteries to all fabrics of the body. The small arteries are related through capillaries and fabrics to the veins, the venous device, which returns blood within the coronary heart and high blood pressure of lungs. Essential is frequently burdened with the mental tension, effort and problem. Important hypertension is usually controllable with the ideal remedy and the perpetual monitoring. There are numerous training of the medicine for the crucial high blood pressure of treatment, those of the medicine known as the antihypertensives. The adjusters of calcium channel reduce the anxiety of muscle within the arteries, growing them and creating greater component for the go with the flow of blood. The reduction of weight and the regular aerobic exercise are recommended like first tiers inside the smooth treatment to slight high blood pressure. The regular tender exercise improves the drift of blood and help to lessen the heart rate at relaxation and the blood strain. Lifestyle modifications can help to reduce your blood strain. This includes the regular exercise, including the loss of weight in case you are a moderate weight. The therapy of relieving, including the meditation, which reduces the environmental attempt, decreasing the excessive noise stages and the with top illumination may be a further method to improve hypertension. The tobacco of suspension employ and the alcohol consumption became shown with hypotension. Dietetic adjustments to decrease grease and to modify sodium in your mode. Salt, MSG-free articles, and the bicarbonate of soda all contain sodium. What causes hypertension, and how to treat it? High blood stress is a huge deal. Because it puts stress in your coronary heart and your arteries, raising your probabilities of a heart attack or stroke. Over time, high blood pressure can harm and slim your arteries, lowering blood waft around your frame. And on account that all of the tissues and organs on your frame need blood to paintings, which means such things as your mind, your kidneys, your eyesight and your sex existence may be affected, lowering the high quality of your existence and shortening it extensively. Salt. As utilized in cooking, in preserving and processing ingredients, and as a flavor enhancer, is sodium chloride, which consists of sodium 40% and chlorine 60% through mass. Salt dissolves in water and breaks up into its sodium and chlorine ions. Your frame cannot make sodium chloride and depends to your food plan for a healthful deliver of this nutrient. As truly each diabetic is aware of, a type 2 diabetic has a higher than 80% chance of additionally being hypertensive, i.e. tormented by excessive blood stress. And all of us recognize that, except taking a everyday medicine to control our blood pressure, we should eat a low-salt food plan due to the fact a moderate salt consumption is the primary motive of high blood stress. But is excessive salt consumption honestly the primary purpose of excessive blood pressure? Current studies endorse that this could now not be so. Is too much salt definitely the cause of excessive blood pressure? Inside the 2017 difficulty of the Yank magazine of medicine, it became claimed in a paper titled "Is Salt a Perpetrator or an Harmless Bystander in Hypertension?" that the belief that a moderate salt intake results in hypertension is based totally on opinion, not on truth. The paper mentioned a Cochrane overview of almost 170 studies which referred to that sodium restriction most effective lowers blood pressure by means of 1% to 3% in human beings with everyday blood stress, normotensives, and among 3.5% and 7% in humans with excessive blood pressure, hypertensives. Cochrane critiques are systematic opinions of primary research in human health care and fitness coverage, and are across the world recognized as the best trendy and evidence-based healthcare. Sugar, the paper went on to assert, is the much more likely primary cause of high blood pressure. This have a look at derived a few aid from a previous take a look at of 133,000 adults, posted within The Lancet in 2016, which located that a high sodium consumption, as compared with a mild sodium intake, was related among hypertensives with a greater hazard of cardiovascular occasions and loss of life. But no such affiliation befell amongst normotensives. But, a low sodium intake became related to a more chance of cardiovascular occasions and dying in both hypertensives and normotensives. This shows that decreasing sodium consumption is quality focused at populations with high blood pressure who devour excessive salt diets. The notion that there is no appropriate science to back up the hypothesis that salt is one of the main reasons of high blood pressure is open to assignment. Certainly, sodium is a vital ion for nerve conduction, muscle contraction and cell signaling, so restricting your consumption of salt unduly can be harmful. Hospital studies displaying that excessive salt intake will increase BP. Latest estimates recommend that, globally, 62% of cerebrovascular disorder and 49% of ischemic heart disorder are on account of increased blood pressure. All meals incorporate some diploma of salt but meat, about 0.3 grams according to kilogram on common, contains extra than greens. And characters' intake of salt in Paleolithic instances turned into much less than 1 gram according to Day. About 5,000 years ago the usage of salt inside the diet started out to upward push after the Chinese located that it could be used to maintain food. Through the years, as the usage of salt spread, daily intake rose to a peak of approximately 12 grams per day in the 19th century. However, whilst refrigeration turned into invented within the late 19th, salt became no longer essential for preserving food and day-by-day common consumption commenced declining, a fashion that endured till comparatively recently. Consumption is now back to 19th century levels due to the rising popularity of tremendously salted processed foods, and currently about 75% of our daily consumption of sodium comes from salt found in processed ingredients. Sausages, rashers, meat puddings, crisps, chips, pizzas, salty cheese and so on. The association among salt consumption in the food plan and blood strain became first shown in 1904 while Ambert and Beaujard experimented with excessive and coffee salt diets on 6 patients. Excessive salt diets made BP, blood pressure, move up, and low salt diets had the reverse effect. In 1948, a researcher named Kempner treated 500 hypertensive sufferers with diets consisting of rice and fruit that contained little salt. These diets advanced BP, reduced heart length, and ameliorated hypertensive retinopathy. But alas, the rice food plan failed to trap on as it was quite tasteless. Seeing that then, many animal studies have shown a causal relationship between nutritional sodium and high blood pressure. There have additionally been vast studies at the impact of salt consumption on BP in people, and the BP reducing effect of a low salt diet has been tested typically. Indeed, lots of subjects had been worried in big international research on sodium intake and high blood pressure, inclusive of the Intersalt Observe of greater than 10,000 topics aged 20 to 59, which confirmed that there is a positive correlation among salt intake and BP stages. This Examine, published within the British Medical Magazine in 1988, additionally indicates that BP will increase with age handiest if it's miles followed via extended salt consumption. Any other nicely carried out landmark have a look at turned into the Sprint, Nutritional Approaches to Stop Hypertension, Sodium Trial. A 12-week nicely managed feeding trial supplied the maximum sturdy evidence approximately the impact of salt consumption on human BP. It changed and posted within the New England Journal of Drugs in 2001. In spite of latest reservations, the link between salt intake and BP levels appears to have been tested scientifically and pretty conclusively inside the last many years. So how can the contradicting consequences of latest studies be defined? Is there every other aspect influencing BP ranges? Sodium and potassium. 2 essential electrolytes. Your frame eliminates unwanted fluids and waste merchandise with the aid of filtering your blood via your kidneys, where the undesirable fluids are sucked out and dispatched with the wastes for your bladder to go out as urine. A combination of 2 vital electrolytes, sodium and potassium, are needed to allow this to take place. Your kidneys use osmosis to attract the water containing the wastes out of your blood. Osmosis is a manner through which molecules of a solvent pass through a semi-permeable membrane from a much less concentrated answer into a more concentrated one. This method uses an aggregate of sodium and potassium to tug the water across a wall of cells from the bloodstream into a collecting channel that results in the bladder. This ratio of the two electrolytes wishes to be within a slim variety for the osmosis process to paintings efficiently. The hassle with eating plenty of salt is that it raises the amount of sodium to your bloodstream and wrecks the delicate stability among sodium and potassium, lowering your kidney's potential to put off the water, so the water and wastes continue to be in your bloodstream. The result is better blood pressure due to the more fluid to your blood and extra pressure at the delicate blood vessels leading to the kidneys. Over time, this extra stress can harm the kidneys, bringing on kidney disease. This reduces their capability to filter toxic waste merchandise, which then begin to accumulate within the frame. If kidney sickness is left untreated and your blood strain is not decreased, you turn out to be with kidney failure. You're no longer able to clear out the blood and the body slowly becomes poisoned by its personal toxic waste merchandise. The best solution is ordinary dialysis, a messy, painful and tedious procedure. Your intake of potassium is critical. The sodium trial, stated above, confirmed that a systematic change of food regimen to enhance intake of fiber, magnesium, calcium, and potassium ought to lessen blood strain considerably. This effect become in addition boosted through limiting sodium consumption. This has considering that been confirmed by means of many studies. Person and blended effects of nutritional elements on hazard of incident hypertension. A study published through American National Library of Medicine, Countrywide Institutes of Fitness in October 2017, concluded that the secret to lower blood strain within the lengthy run changed into to consume a eating regimen this is both low in sodium and excessive in potassium. Research in latest years has shown that potassium intake at once regulates how an awful lot salt, sodium, the kidneys excrete. Excessive potassium consumption forces the kidneys to excrete extra sodium. In different words, increasing dietary potassium is simply as crucial as reducing sodium in terms of lowering blood stress. The want to hold potassium range is strong. Not like sodium, which circulates dissolved in water within the blood, potassium is focused inside your body's trillions of cells. This awareness in the cells is maintained by a pump that acts throughout the cell's membranes, outer partitions. A regular concentration of potassium in blood plasma is between 3.5 and 4 millimoles in step with liter. Half of or double these concentrations is risky and may, certainly, be deadly. If you have too little potassium, you'll first word it in your muscle mass. As an instance, your muscle mass will feel weaker and lifting heavy gadgets may be hard. But if you have a good deal too much potassium for your blood, you can up with cardiac arrest. Some states in the U.S. use large potassium injections to execute prisoners on death row. But do not get over-involved. Insulin enables transfer potassium as well as glucose into your body's cells. The kidneys additionally excrete potassium. Wholesome kidneys are very green at maintaining the precise amount of potassium to your body. But in case your kidneys aren't functioning properly, and you are not on dialysis, rising potassium degrees can be lethal. As we already referred to, excessive potassium intake lowers blood strain, and there's an immediate link among a low potassium, excessive sodium food regimen and raised blood pressure. As a result, controlling the frame's potassium stage is critical for fitness. But it is simplest lately that the position the kidneys play in preserving the degrees of sodium and potassium has been determined. If you have lost a lot of potassium these days, the kidneys want to hold onto the body's closing potassium. Certainly they prioritize the retention of potassium over sodium. When the extent of potassium is too low, a sensor in the kidneys tells the renal tubules, the kidney's pipeline, to take in more sodium, which finally minimizes the loss of potassium. However, this retention of sodium raises blood stress. Conversely, if you ingest plenty of potassium, the body keeps less sodium for you to promote the excretion of potassium. This explains why consuming potassium-rich ingredients has a useful effect to your blood strain. It drives extra sodium to be excreted. The great remedy. So the dietary advice of a low-salt diet has no longer changed. However, now it comes with additional recommendation to make sure which you have in good enough intake of potassium also. The takeaway is that eating lots of potassium is just as important as prescribing salt or sodium intake. And, as success could have it, there are lots of ways you may get lots of potassium into your frame without resorting to dietary supplements. Culmination are nice. apricots, bananas, oranges, lemons, grapefruit, plums, grapes, figs, olives, blueberries, peaches, gooseberries, tomatoes, apples, prunes, and raisins all contain varying stages of potassium. Appropriate vegetable sources encompass potatoes with the peel on, cauliflower, lettuce, cress, spinach, beetroot, and celery. Different good sources of potassium are nuts, almonds, legumes, oats, complete wheat, and clean meat. Stem cell therapy will completely cure hypertension from your body. You can ask me how. Please subscribe and share our YouTube channel. Thank you.